Well, thank you for joining us today. My name is Dr. Richard Spellacy, and I'm the Registrar and CEO of the College of Alberta Psychologists. Prior to beginning our information session on continuing competence, as one act of reconciliation, I would like to take a moment to give our land acknowledgement. It is with respect and in the spirit of reconciliation and truth, the College of Alberta Psychologists honors and acknowledges that here in the Alberta, Treaties 4, 6, 7, 8, and 10, as well as many unsigned treaties, are the traditional and ancestral territories of many diverse Indigenous peoples. Namely, they are the Kainai, the Kainai, Siksika, Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, Tsuut'ina, Inuit, and the Métis Nation. We acknowledge and give thanks to the many First and Métis Nations and Inuit peoples who have lived on and cared for these lands for generations, and the many others whose histories, languages, and cultures continue to influence our vibrant community. We are dedicated to ensuring the spirit of all treaties are honored and respected. We make this acknowledgement as an act of reconciliation and gratitude to those whose territories we reside on or are visiting. For those of you joining us today, please note this information session will only deliver information on CAP's Continuing Competence Program. You can access the previous town hall meetings held on November 18th and December 7th on your YouTube channel. They also include information on how to complete a supervision plan under our new member management system. I invite you to subscribe to our YouTube channel to get all recent updates and notifications. Today, I would like to take a moment to introduce Dr. Troy Janzen and Dr. Dina Martin, who are joining us today. I will start by introducing Dr. Janzen, who will be this afternoon's moderator. Dr. Janzen currently serves as the Chief of Practice and Deputy Registrar and Complaints Director. Dr. Janzen has worked in the areas of assessment intervention with children and families in hospitals, schools, and private practice settings for over 2 decades. He also has extensive experience working in and for Indigenous communities, providing both clinical and program expertise. From 2009 to 2017, he served as the University of Alberta Department of Educational Psychology Clinical Supervisor and Practicum Coordinator for the CPA accredited school and clinical child psychology program. He continues to serve as an adjunct assistant professor in the same program. Prior to the U of A, Dr. Janzen was chair of the psychology department at the Taylor University, where he helped establish an undergraduate program in psychology. Dr. Janzen will moderate our question and answer period following Dr. Dina Martin's presentation. Dr. Dina Martin currently serves as CAP's Assistant Deputy Registrar and Director of Professional Guidance. Dr. Martin's career has focused on competency development of those in helping professions. Her teaching portfolio includes undergraduate and graduate teaching in the areas of professional ethics and the law, counseling, leadership, research methods, and statistics. This is an exciting time for both CAP and our profession. On September 30th, 2021, CAP launched our new member management system, affectionately referred to as the MMS. This is our digital platform designed by the Softworks Group, also known as Alinity Softworks. It's intended to support CAP's digital modernization goals and our desire to move forward toward a paperless environment. The Alinity platform was selected after an extensive needs analysis was conducted by an independent third-party consultant. This was followed by a request for proposals process where Alinity was selected as a successful candidate. Some of the perceived strengths of Alinity platform include their Alberta location and their track record with other regulated health professions. Their references were also stellar. The Alinity platform will modernize most aspects of the college administration, from registration applications to finances. While the college has existing member and professional misconduct databases, these will now be housed in a more interactive and integrated manner. The overall objective is to allow members increased ability to actively manage their CAP profile. The MMS will also provide our digital platform with a much anticipated continuing competence program, commonly referred to as CCP. As Dr. Dina Martin will elaborate further on, a long-awaited CCP program, which will be launched on February 1st, 2022, in conjunction with our annual practice permit renewal cycle. Launching of the CCP is also an effort to bring CAP into the modern era, as most self-regulated and many non-regulated professions have mandatory continuing competence requirements. It is typically viewed as a quality assurance mechanism, ensuring self-regulated professionals maintain their competency by keeping pace with the evolving nature of the science and research underlying their clinical practice. In my opinion, it also suggests a level of profession's maturity. An additional feature of the MMS is financial management. The MMS will allow applicants and members to pay application, examination, and registration renewal fees. It will also allow applicants and members to obtain receipts. Internally, the MMS will be linked to our accounting system and simplify financial entries. This will be particularly helpful for timely financial reporting and forecasting. It Overall, CAP is excited about this opportunity to continue to modernize our practices, increase member participation and interaction with the professional profile, and gain many administrative efficiencies. As many of you know, the CCP has long been delayed because of lack of regulatory approval. Given this long delay, CAP sought a legal opinion and a decision was made to develop a standard of practice to address our CCP requirements. More recently, Alberta Health has adopted this strategy to address the same problem for several other regulated health professions. This may result in further changes as recent legislation is being rolled out over the course of 2022 that may require an additional consultative process. Notwithstanding, CAP is of the view that we have the regulatory framework in place to move forward. Any future changes will be done in a staged and transparent fashion. It is, however, believed that our current program parameters will likely remain the same. So the time is now. Now I would like to turn over to Dina Martin to begin her presentation on the CCP. Take it away, Dina.
Thank you, Richard. I'm actually going to invite Troy to speak a little bit about using the Q&A function as we get started here. Good morning,
Thanks, Dina.
Troy.
Yeah, some of you may notice on the bottom of your screen, there are several options. If you move your mouse around, you'll see Q&A. The chat function is disabled. You will not be able to use that, but you can use the Q&A to answer any, to ask any questions you have as Dr. Martin presents on the CCP program. I'll be monitoring your questions, and in some cases, we may be able to give you a direct answer in text right in that format. Others may have similar questions, and so you can actually vote it up or vote it down. So things that people say, yeah, that's a question I have too, can thumbs up, or I forget the exact interaction, but there's a way to make sure it's voted on so that common questions get prioritized. So I'll make sure to pay attention to that. So I look forward to Dr. Martin's talk. If anyone has any questions, you can put them in the Q&A section. Thanks. Go ahead, Dina.
Thank you so very much. Okay, well, welcome everybody. I can see we have quite a few attendees. It's pretty exciting. This is the third one. So we put together a set of slides. So let's see, our plan for today here is to introduce the program, the Continuing Competence Program. We'll spend a little bit of time talking about the resources available. We've worked really hard to make some fantastic resources for you folks. We've got demonstrations ready to go for you today as well. And then we're going to spend some time doing a Q&A. So I won't repeat Dr. Spelicit's remarks, but he just mentioned here, pardon me for a second, my puppy's a little bit excited that we're presenting together. Dr. Spelicit spoke at great length about why here, why now with the Continuing Competence Program. There's some regulatory reform happening, as well as its time. And of course, we've got this new fantastic member management system that we think will be a great resource for us. So Kira, will you help me take it away here? And let's just jump right in with the introductory video.
College of Alberta Psychologists Continuing Competence Program. For the remainder of this presentation, we will refer to the College of Alberta Psychologists as CAP and to the Continuing Competence Program as CCP. We developed this video to provide helpful information about the role and design of the CCP so that our regulated members are aware of the annual requirements for the profession. The information contained in this video is from the CAP CCP Member Guide. Note that this program guide, along with additional resources such as FAQs and technical how-tos, can be found on the Continuing Competence page on the CAP website located at www.cap.ab.ca. CAP's CCP is designed to meet Section 50 of the Health Professions Act regarding continuing competence for all regulated health professions in Alberta. The program contributes to public protection by helping ensure the public receives safe, ethical, and competent professional services from our regulated members. The CCP also elevates the profession's reputation by promoting the pursuit of excellence in professional practice. When designing the program, efforts were made to ensure the program was both practical and flexible for all, meaning for our members, our administrative staff, and also for those who will participate in the professional review process. This program formalizes and complements the profession's commitment to continuous learning and ultimately public protection in the delivery of safe and ethical psychological service. CAP defines competence as a multidimensional construct that is generally considered to be comprised of the following components: knowledge, skill, judgment, and diligence. In regard to knowledge, psychologists are to maintain and ensure the accuracy and currency of the scientific theories and evidence relevant to their practice. Moving to the concept of skill, psychologists monitor their ability to effectively apply scientific theories and methods in their practice. Judgment is defined as psychologists applying their knowledge, skills, and experience in a way that is also informed by professional standards, laws, and ethical principles. Lastly, diligence means that psychologists carefully and persistently attend to their knowledge, skills, and judgment as applied in professional activities, being careful to prioritize the client's needs. This color diagram depicts CAP's CCP 4 core continuing competence areas. In total, members will complete a minimum of 24 required hours and participate in 3 wellness activities. Let's break this down further. Starting at the top right corner of the diagram, members are to complete a minimum of 8 hours in scientifically supported professional practice. The focus of this area is to ensure members acquire and maintain their theoretical and scientific knowledge base appropriate for their professional activities. Please refer to the CAP CCP member guide for examples of activities that fit in this area. Next, members are to complete a minimum of 8 hours in the activities related to furthering their knowledge and application of ethics and jurisprudence. The focus of this area is to ensure psychologists acquire and maintain their knowledge of the professional code of ethics, standards of practice, practice guidelines and alerts, case law, and legislation relevant to their practice. In the area titled Professional Engagement, members are to complete a minimum of 8 hours connecting with other psychologists on a routine basis to foster and instill a commitment to both the profession and the practice of psychology. This may involve being a member of a professional association, volunteering with a regulatory body, and many other activities. Again, please see the CAP CCP member guide for examples. The remaining quadrant addresses wellness. The intention of this area is to ensure psychologists actively engage in activities that promote professional well-being. For this area, members will identify and participate in 3 wellness activities as part of their continuing competence program. In summary, members are to complete a minimum of 24 required hours and participate in 3 wellness activities annually. There are 3 explicit steps to participating in CAP's CCP. Each step was developed to answer a question that would move a person logically through the CCP process. In step 1, members describe their practice and fill in fields related to the branch of psychology, professional activities, practice context, and client focus. In step 2, members write personalized SMART objectives across the 4 core categories of continuing competence. And finally, in step 3, members record and evaluate their CCP activities. Members are encouraged to keep their practice profile, goals, and CCP activity records up to date throughout the year. They are also encouraged to plan their CCP activities in advance of each practice permit renewal cycle. Administratively, the CCP directly aligns with the practice permit year, starting April 1st and finishing March 31st. At their first practice permit renewal, members must complete steps 1 and 2 prior to receiving their practice permit. For all subsequent practice permit renewal years, members must complete steps 1, 2, and 3. All regulated members are required to participate in CAP's CCP. This applies to fully registered psychologists, registered provisional psychologists, and members who may hold registrations in more than one profession and/or who are registered in other jurisdictions. Exemptions to participating in the CCP is limited to those on the courtesy registrar, those who are on parental leave, and those who received approval from the registrar directly. CCP audits are conducted annually to confirm member engagement and may consist of a computer, administrative, and/or professional review of the member profile. Each year, psychologists will be required to submit a declaration of program participation as part of their annual practice permit renewal. A percentage of these CCP profiles will be selected for review as a result of random selection, a late or incomplete submission, or a request from the complaints director. As part of the audit, a psychologist may be asked for clarification, supporting documents, and/or enhancements or revisions to their CCP profile. When the audit is complete, psychologists will be notified and receive feedback on their continuing competence profiles, including further instructions if required. Thank you for watching this presentation on the College of Alberta Psychologists Continuing Competence Program. If you have questions, please refer to the CAP website for additional information and resources.
So we'll spend a few moments just, I'm sure the questions and answers might start rolling in now, and we've got a couple of people on the lines attempting to give you guys a hand with that. But if you want to save your questions to the end, that's okay as well. We do have a lot of information to go through here. So with the 4 core categories, just to revisit them again, there are 4 different areas where we would like you to write some goals: the scientifically supported professional practice, the ethical and jurisprudence informed, and professional engagement. We've also included 3 activities under the wellness participation. So this gives a nice depth and breadth to our members' requirements. Under the 3 steps, we've broken down the continuing competence program into 3 basic steps to help you move through. The first one being describing what I do, the second one designing my content, and the third one documenting what I've done. So we feel that this is just really straightforward, a matter-of-fact way to proceed through the process. We have some sample goals here to share with you today. These sample goals, there's a variety of places if you're looking for examples. The examples can be found in the CCP manual online. We've updated all of our documents just this week, so we are excited that it's the most up-to-date information. There's lots of resources. I'll walk you through those in a moment. But please know there are sample goals both in the Continuing Competence Manual as an appendix, as well you can find goals in the How-To Tech Guide as we have 2 samples. So a couple of sample goals in the area of scientifically informed professional practice. A goal would be, I will learn new techniques on supporting children in trauma by attending a 2-day conference by January 30th, 2023. So we're looking for those SMART goals: specific, measurable, achievable, right? Realistic, time sensitive, those kind of descriptors. There is links in the how-to manual, as well as more information in the manual itself on how to write SMART goals. So a goal for ethical and jurisprudence informed practice could look like, I will read and discuss the CAP standards of practice and practice guidelines with my peer consultation group by the end of December 2022, okay? A goal for professional engagement, that one that I just read on ethical and jurisprudence could also fit under professional engagement or could fit under ethics. So we are aware that some goals will fit in more than one area. But a goal for professional engagement is I'll continue, I will contribute to regulatory accountability by serving on the CAP Practice Advisory Committee throughout the year, ending in March 2023. So any type of professional engagement that you do, committees that you sit on, whether it's through the PAA, through a national or international association, whether it's through the College of Alberta Psychologists, and even some of the interdisciplinary work that you may do through your workplace, if you're in formal employment, would also be eligible to be counted as some of these professional and leadership and engagement type activities. The last area we talked a little bit about in that was the quadrant on wellness participation. So an example of a goal in that area will be, I will maintain my physical health by attending a weekly 90-minute Pilates class throughout the year, ending March 2023. So in terms of the CCP goals, this is our first year. We're doing our best. There's no perfect goal, so please don't hold yourself to that standard. Do your best, use your professional judgment, think it through. We're trained professionals in this area, so we're confident we have the judgment and insight to write goals like this. There is in the manual an appendix as well. Some of you may be thinking about the work that you do already and how to transform that into your continuing competence goals. And so there is an appendix there available for you to how to decide where this activity fits, recognizing that some of the activities you do may fit in more than one quadrant, and how you make good decisions about where you place those. Okay, so a little bit more about the continuing competence activities. We've broken the activities for continuing competence down into these categories: academic coursework, professional training, self-directed study, research scholarship, professional leadership and engagement, wellness and healthy lifestyle. So academic coursework, there's more descriptors that go along with that. So you may be a student, you may be an instructor, you may be a guest lecturer, etc. Professional training, this is where conferences and webinars and the ethics discussion tables that the PA is happening, hosting would fit under professional training. Self-directed study, this is where you may belong to some online groups where you follow up on readings and you stay active and current in special topics. So you may have a list of resources that you're going to read in the upcoming year as you take on perhaps a new area or take your knowledge in an area further. Research and scholarship, we had some great feedback from the university folks on this area. So the descriptors on research and scholarship around the area of disseminating research outcomes, the various different ways that you can contribute to it. Professional leadership and engagement, this is where you're going to find things like your supervision hours. If you're a supervisor or mentoring student or provisional, you'll also find your membership in professional associations there. So if you're looking for more insight into what these CCP activities are, I'm going to sound like a broken record here, but please revisit the CAP manual. It has examples of all these sorts of activities and their subdescriptors. And it also has a list of the type of documentation that you may want to have access to when it comes around to uploading and evaluating and documenting your activities in step 3. Okay, I said I would talk a little bit about the web page here. The web page is going to look a little bit different depending on how you're viewing it. So this is how the web page will look like if you're accessing it from your perhaps your tablet or your smartphone. Where the arrow is pointing, the little circle up there, that is where you'll be able to find the Continuing Competence Program page. You can see the My CAP login there is just on the top right-hand corner. Whereas if you're accessing the Continuing Competence page from a web browser, this is what you'll see when you go to the actual web page and scroll in, and the Continuing Competence page is there. And so what you're going to find on the Continuing Competence web page is we've got the manual. This is fantastic. If you've had a look at it before, please take the time to take a look at it again. We expanded it by another 10 pages as we got more integrated into the technology. There's more details. There's more details in the area of auditing. And all of the sample pages that were up there previously have now been integrated into actual appendices. So the CCP manual itself is a fantastic first place to go. The CCP FAQs, because this is an inaugural program, I use my crystal ball to try and figure out what types of questions are people going to ask. Please feel free to send in your questions using the question feedback box at the bottom, and we will be expanding our FAQ as appropriate. So again, I apologize if I didn't anticipate the question that you had, but we did try to guess what the majority of the questions are going to be. So a great resource as well. I'm sure many of you have already read the CAP Monitor issue number 67 that came out before Christmas. And that's a beautiful CAP Monitor. And then it really talks about continuing education in that our continuing competence from a larger perspective. We've got some fantastic Canadian researchers contributing to that edition. As well, we had a colleague from another college give feedback on our program. Other resources that we have, so that's the content side of the house. We're going to transition this presentation a little bit now to the technology side of the house. Richard spent a lot of time talking about the member management system. So to help navigate that, we realize that's new for us, that's new for you folks. So not only are we implementing a new continuing competence program, we're overlaying some technology on it, but we're here to work together to move everybody through this as much as smoothly as possible. So for those of you that are really tech savvy, feel free to jump in there and play. The quick start guide is available if you need a little bit of help. For those of you that are want to see the process kind of step by step with lots of images and circles and arrows and do this, do this, do this. I don't even know how many pages the tech guide is. I'm sure it's 30 pages plus. Charmaine and I worked really hard to really walk members through step by step how to do each aspect of the continuing competence program. Again, we tested this out. We had, I think we've had at least 25, 30 people go through the program and offer us feedback and able to navigate really intuitively, really comfortably, really confidently without these resources. So these resources really are there for those who are a little bit kind of unsure about new technology. Which brings us to our next resource, which is the optional paper planning tool. So for those of you that really just are a little nervous about the technology, no big deal. Let's break it down step by step. Start with the optional paper planning tool so that when you actually go on to working with the technology, you already have all of your goals and everything ready just to enter. But for a good part of the membership, we really expect that they'll be able to get going as soon as February 1st opens. So with that being said, I actually just going to plug something here, is that you can access your CCP now, but we don't encourage it. As per the webpage, February 1st is when Renewal opens, and that is when it's a good, safe time to jump in and start working on your CCP. We are still testing and demoing and erasing and existing plans and that kind of thing. So if you want to go in there and have a look, you're welcome to, but fair warning, whatever you do may or may not be available to you from February 1st onwards. And I'll repeat that reminder later today. The last thing that we've developed for you, and I think we're going to go to right away here, is the actual CCP playlist. So we actually have 3 5-minute videos to help you step by step for those that aren't that are wanting a little bit extra support. The last 2 things we have available for you. So today, if you're at the end of the session, if you're interested, you're welcome to go to our CCP web page on the CAP website, where we have an implementation survey, right? This is a big initiative. We're rolling it out live. We're learning as we go, and feedback is welcome. And that is the best way to send feedback, and easy for us to distribute, easy for us to access. This implementation survey will be open for the first year, and it will help us capture our learning and growth, I think, as well. The last thing is we have CCP question feedback. So if you have a question, feel free to, again, go to the CCP webpage, use that box, and that will be how we communicate back and forth with us. That will be great, help us manage the workload. Other things on the website, CCC submission dates. We will keep this updated throughout the practice permit year. So again, February 1st is when the CCP CAP login begins. And when people can go and start working on their continuing competence program, this is also when Renewal opens for people's practice permit year. Okay, moving on to the demo. You heard Dr. Spelicity and Dr. Janzen vote for all 3 videos, so I'll let you carry it away.
In this demo, we are using Chrome, as this is the web browser that is most highly tested for our program and ensures you have access to all the program features. You can access the online platform from your computer or mobile device by clicking on the My CAP login found in the top right-hand corner of the CAP website. Clicking this button will take you to the My CAP login screen, where you will enter your username and password. Your login username is the personal email associated with your member profile. This is the one where CAP sends you regulatory information. If this is your first time logging in, please reset your password. The reset password email will be from Alinity. Please remember to check your various folders such as junk, spam, promotions, etc. for this email. Note that CAP does not have access to your password and cannot retrieve it for you. Pressing the login button will take you to the main portal page. For this demo, we are using Dr. Anna Freud's login. To locate the Continuing Competence program, you'll want to go to the left-hand navigational column where you'll see a variety of tabs. Click on the My Learning tab. This will take you to an entrance page for the Continuing Competence program. Over time, you'll be able to see all your annual Continuing Competence programs listed here. If this is the first time you're entering a plan for the year, you'll need to create a new plan. To do this, there'll be a plus icon to add a plan for the current registration year. And if you need more information, you can see the how-to tech guide for visual images to do so. If you already have a plan started and you would like to make changes, simply click the chevron or arrow and you'll be in your Continuing Competence program. Note that while your plan is available throughout the year, not all program features are available all year round. Some steps and activities within the steps open and close according to practice renewal periods. Please see the CAP CCP webpage for information on all relevant timelines. Now that we are logged in, let's spend a few moments navigating the Continuing Competence area. First and foremost, there are 5 separate tabs, also called pages, across the top of your screen here. This is how you will navigate the Continuing Competence program. So when you open your program, you'll first come up on the practice profile page. There are 2 different things you'll find on this page. First, you'll find a set of instructions, which we really strongly encourage you to read, of course, and then secondly, you'll have the fields where you fill in your practice description. Okay, you'll scroll down to the bottom here. You'll notice that there's also boxes here where you can navigate arrows that will move you through the various tabs or pages, much as if you were clicking on the top. If you find yourself not knowing where you are, you can simply scroll up to the top and you'll see here that the Ethics and Jurisprudence tab is slightly pronounced with a tab or bar going across the top here, and you'll know you're on the Ethics and Jurisprudence page. So you can simply navigate back to the Professional Knowledge and Practice page by clicking on it again, or you can navigate using these buttons at the bottom. While we're at the bottom here, I also want to show you the Save for Later button. This is going to become your best friend. So when you are done entering something on a page, you're highly recommended to hit the Save for Later button. By doing so, it's going to save your work and you'll get a notification up in the top right hand corner that your plan has been saved, and then you can confidently navigate to another page. If you do not hit the Save for Later button and inadvertently use perhaps a back button here or your back button up here, what's going to happen is that your work is going to be lost. So truly, at the end of every page, please remember simply to scroll down, hit the Save for Later button. You'll know your work is saved and you can confidently navigate from page to page, not worrying about losing anything.
Okay, so a couple things here, tips and tricks, things to know. Recognize this is new learning for everyone, so be patient with yourself. It's a learning curve. It's going to take some time. That's true. When possible, connect with colleagues. Learn this together. Always more fun to do it with colleagues sitting around with your laptops as opposed to at home by yourself when you run into troubles, you know, nobody else to share with or help you navigate through any hurdles if they arise. Please make use of the resources available. We've worked hard to develop them, and we're confident they are going to be fantastic and helpful. And then if you're really concerned, take the time to write your CCP goals first and learn to navigate the technology later. As we said with the technology, use Chrome as your browser. This isn't a choice that CAP's made. This is a choice that our software provider who runs this program uses and recommends. You can use other browsers such as Firefox and Chrome and, Firefox and Safari. The challenge is that not all features will be available to you. So you may think it's working, but it's not working as robustly as it can be. So Google Chrome is definitely the preferred browser. When you're in the CCP, stay in the CCP. I tried to mention that in the video. Using back buttons and that kind of thing can mean that your work will be lost. So that Save for Later button is important. We originally had 20 minutes per login. That's been extended to 60 minutes. So we feel like that's going to be enough time for folks to be able to navigate and get there. That should be lots of time for people to be able to get their CCP entered into the MMS. And the last thing just to be aware of is be cognizant of scheduled maintenance. So if you say, I'm going to spend Sunday night doing my CCP, then log in on Friday or Saturday just to make sure that there is no scheduled maintenance. There is maintenance monthly and of course quarterly. So you don't want to run into any snags there. As always, any type of project like this takes a team. We're so thankful and grateful for all the people that have offered feedback, have tested our materials, for the guidance. You know, this has been a long time coming, you know, years working on it and different stages, different aspects of it. We really appreciate, again, Practice of the Council for their guidance and feedback. Practice Advisory Committee took a go at it. Former council members, colleagues from other colleges, and of course our internal staff has just been fantastic. The last thing before I head over to questions and answers is just please note that steps 1 and 2 of the CCP can be done independently and or as part of the registration practice permit renewal. Okay, so you can go in, so you can choose to go in and register and then complete the CCP as part of the registration process, or you can go into the CCP process again starting February 1st and do the CCP first and then go and complete the renewal process for your practice permit. Please, you know, I'd be very cautious in entering any information into the CCP until February 1st. It may be overwritten. And then the last thing, just a frequently question that pops up now and then is this CCP program does not require CAP approval. So we're not using any sort of continuing education credits. This is written up, I think, in the FAQs as well as the CCP manual. You are to use your professional judgment about your activities and where they fit and what's a reasonable resource. So please don't feel that you need to submit, you know, a conference outline or a training work line for training outline for pre-approval to CAP before entering it into your CCP. So turning it over to the question and answer, unless Troy or Dr. Janzen or Dr. Spousey would like to add anything.
One of the questions that's coming up, I thought maybe if you could just really re-highlight the flexibility that we intend behind writing of goals in the step of writing goals. Several people have asked questions about, well, what if I don't know exactly what PD I'm going to do? How specific do I need to be? Things like that. Can you maybe talk a little bit about that?
Great question. So for Dr. Spellacy, do you want to start off with this, or do you want me to start and do you want to supplement?
I'm happy to answer the question.
Okay.
You're quite correct that occasionally you may not know exactly what you're going to do. Now, at this time of year, many of you know belong to APA, will see that their webinar for the upcoming year, their catalog has been published. That information is coming out. But if you're not certain, but you might about that. So, for example, when I did my CCP work through, I indicated that I planned to attend 5 APA seminars of an hour long throughout the course of the year, and I didn't list those because I wasn't sure which ones I'm going to do. But I do between 4 and 8 of those hour webinars each month, and I will simply document which ones that I watch and then find the relevant area for that. But my goal will be to attend those webinars in the area of professional, scientific professional knowledge throughout the course of the year. And then the proof I intend to do is write down the dates I attended and the topics that they were presented. And I will submit that, I will upload that to my profile to indicate that I have attended those. Also for professional engagement, because I belong to CPA and APA and PAA, I will just simply upload my registration number and say that I'm active in those years to get that credit for my professional engagement. for my activities for wellness, I put down activities that I engage in currently, and look at things such as I too, like Dina, have a dog, so I'm going to commit to walk my dog half an hour, 5 to 7 days per week each day. That's one wellness goal. Another goal is to dedicate one evening a week for family engagement. And again, that goal doesn't require documentation, but I have that goal set out. It's time specific. It's relevant to well-being, and it fits the categories of a SMART goal. So no, you don't need to have your whole pre-planned year, but you may have some activities. For example, for the area of professional engagement, I know that I'm attending two-day conferences in the fall and in the spring for ASPPB. So I will put those in as another example of professional engagement or scientific learning. So those are the kinds of things. So you don't need to put your specific goal, but you want to set the goals as close to it as you can, and then you're allowed to revise that goal and upload that documentation to your practice profile. So that makes it flexible. I also saw the question about a person who indicated, will their employer have to pay for my courses? Well, that's between you and your employer. However, some employers also offer professional development training. And for example, you may attend a conference on the MMPI. And you could say, well, I've attended a 4-hour course on the MMPI, and load that to the scientific knowledge quadrant in your CCP. Now, I think Dina emphasized, and Troy as well, that we're looking at flexibility. So you might say, well, does this activity fall in this quadrant or this quadrant? Well, what we're looking at is for you to think carefully where it may best fit, and that flexibility is going to be respected because what we're looking for is we're looking for engagement, we're looking for intentional professional growth, and that the judgment was not going to be, well, you misplaced this quadrant in this. You might get feedback for the next year. You should place that in this quadrant, but however, for this year, it's fine, especially this year, because this year, in doing those first two stages, what we're looking for is to help us understand where people need more information and help us guide the profession in that direction. There was another question about retirement. Troy, did you see that question? Did you want to answer that question?
Yeah,
retired.
I've got all the questions, Richard. So yeah, I've been answering some questions as we go, but the next question that I was going to address to Dina is, and you've partially alluded to it in your example, is several people have questions about what's required for documentation. One thing I'll just reinforce is that we aren't requiring any documentation for wellness activities whatsoever. Is that correct, Dina?
That's correct. We won't be auditing the wellness, looking for documentation in your activities. Please see the CAP manual. In one of the appendices, there is a description of the categories, the sub-activities within the categories, and then possible types of documentation associated with the activities that you do. So it's a variety. If you're a student, you might include, or faculty, you might include the course outline. If you're a guest speaker, you might include a summary of the date you talked to which university, which class, on which topic. Some of the activities some of the documentation you submit will be self-generated in that you document. For example, I gave the example of using your peer group. You're going to review the Code of Ethics, Standards of Practice, and Practice Guidelines. So what I would do is perhaps generate a set of meeting minutes, right? Here are the meeting dates that we met, who's all met, here are the key topics and documents that we reviewed. So some of the documentation will be more formal, like maybe you'll submit a receipt from a conference that you attended, or maybe you'll include a copy of the conference brochure with the sessions that you attended circled. So the type of documentation at this point will be quite vast and broad, depending on the formality or informality of the types of activities that you've selected to carry out your continuing competence.
So Dina, that's helpful. Some people are asking if there's a difference between what you're referring to as a member program guide, which is what it says on the website, and a manual. Is that, what do you mean when you say manual? Like if there's a tech guide, a quick start guide, a member program guide, FAQs, and an optional paper planning tool is what I see as CCP resources on the website. When you say manual, are you referring to the member program guide?
Yeah, the program, I apologize, we recently renamed it, and it should say program CCP manual. Initially, we were calling it a program guide, so I apologize if my language isn't, if I don't have it quite right. I can have Kathy update that. I apologize. It should read member manual, correct.
And I think the reason for that confusion is simply because the government and their framework, which they're still developing for colleges, refers it to as a program manual. And so we previously were calling it a guide, but we will make that clarification. So yes, they're synonymous, they're the same document. Troy, I just wanted to kind of address a couple of other questions, if I may. There's a question about why are we including a wellness component to our program? It's because we feel that wellness is an ethical imperative, and that self-care is critical to providing for care for others. Now, the reason why we're not asking for documentation is that we don't want to delve in too deeply to people's personal lives. But however, we think it is a professional and an ethical imperative, especially as psychologists, because we know that self-care, work-life balance is critical. So we think that's really important. And so when you're formulating your goals for that, you can be as broad or as narrow as you feel comfortable. So you can say, I might engage in mindfulness, or I'm going to dedicate 3 hours a week to my family. Something as simple as that, that indicates that you have reflected on your self-care, wellness, and you're putting it down in as broad form as you feel comfortable. And there are other professions that emphasize the self-care, and it is increasingly being recognized as an ethical imperative. There was another question about if I have started a course and I'm going to complete part of the course in the upcoming practice permit renewal period, can I count that? For sure, you can count that because you were doing those hours during the during that fiscal year period between April 1st of one year and March 31st of the next year. There was another question. I guess we understood the question about the employer. About is there something I can show them that it's required for licensure? Yes, you can show them the program manual. You can print the manual. You can it'll be on the website. You can show them our annual report from last year that outlines the program. So there are documents that you can share with your employee. When do we have to submit documentation is another question. Yes, we are asking you to submit documentation, and it can be anything from a receipt, copy of a cover of a journal or a book. It can be, if there's no documentation, you can say that this is my, I attend a peer group consultation on these dates. So it can be as much detail as you have available. It can be CE credits. You can take a snapshot on your phone of your CE certificate and upload that document to your practice profile. So again, if you are wanting to do that, we encourage that because that's a simple way of, if there's a question raised, you've got the information already there. It's at hand. You don't have to look for a documentation or doing anything. So you could be in that workshop setting, and some give you an evaluation of the workshop. You could snapshot that, and that just suggests that there's a paper trail for you for attending that, that workshop. So again, we're going to be flexible on that kind of documentation.
Yeah, and I think you have addressed most of the questions that are that have come up. Some people are saying like that sort of relates to the specificity of their goal statement. They're saying like they haven't announced the specific PD sessions for the next year, and how specific do we need to be in our goals. And I think that if you don't have the specific titles, I mean, specificity is always helpful in goal setting. I think we've said in our manual, you know, SMART goals are usually helpful because they're more achievable, but we also recognize that you may not have a complete list of information. So maybe Dina, you can talk about specificity in goal setting, and possibly also talk a little bit and reinforce the start time for when this is it. There was a number of people that expressed confusion about the start date, when it goes live, what you have to do before the first permit renewal, and what you can do after that.
Sure, thank you for that, Troy. Okay, let me start with the first question about start dates. So because of the limitations and the advantages of our system, we're using the computer to do a computer audit of activities. So that means that we really need to keep things crisp and clear, and activities for your continuing competence start on April 1st and would end on March 31st of the following year. As Richard said, we follow the fiscal year or the practice permit renewal year. So we don't have the ability to port activities, you know, so if I did an activity this month, can I count it for the 22-23 year? No, I would start counting activities April 1st onwards. Okay, and so we just don't have the ability to move things, port things back and forth from year to year as it affects our audit process. The question about, go ahead.
Just to, sorry to jump in, to answer that question, just to add a little extra to that, our system goes live on what date?
Oh, fantastic. So two parts to that question. February 1st is when we complete steps 1 and 2. And so for this year, our inaugural implementation year, steps 1 and 2, we are planning for our continuing competence program for the next practice permit year. There is nothing needed for this existing practice permit year.
Well, let me just clarify what I heard you say. So on February 1, our permit renewal goes live, and you will be able to access our CCP program on that date. But all you need to enter are your goals and your practice plan, but you don't have to enter activities or hours at this stage, because you're just setting goals and that's it. Correct?
Beautiful. Correct.
Yeah.
And then
yes, Troy, sorry, I'm going to jump in there, but in addition to describing your practice, Troy, so you'll be doing the first 2 stages, you'll be describing your practice as a way of intentionally looking at what professional activities am I engaged in, and then you're going to set your goals. And then there's nothing else required except as throughout the year after April 1st, you will, so if you're registering between February 1st and March 31st, it's the first 2 steps, describing your practice and setting your goals. After April 1st, you will be entering what you've accomplished towards those goals.
Beautiful. The second part of the question, Dr. Janzen, was the idea of the level of specificity. So let me tell you what I did, and I'll be very honest here, confessions from Dina. I called Dr. Spellici and I said, all those ideal goals and samples that I gave in the CCP manual, it's pretty hard to do because not all the PDD sessions that I would like to attend are announced, or CCP continuing competence activities are. So how I went about entering mine were, I plan to attend 10 hours of training in my area of specialty through webinar and through self-directed study. And so we talked about step 1 and step 2 occurring before you're able to renew your practice permit. And once April 1st comes, and I don't think I've had a chance to mention this, so I apologize. I think it's really helpful. You will be able to go in and edit. You'll be able to continue, discontinue goals. You'll be able to refine and update your goals. So steps 1 and 2 is really to help you through the renewal process. But please know you can update your practice profile, you can update your goals. There's lots of reasons why to update your goals. Have a look at the video step 1 and step 2 on the CCP video. It walks you through step by step, as Dr. Spelicity said, the 4 areas, the branch of psychology, the professional activities, the professional context you work in, and the clients. And then it also walks you through the examples, and you can have a look not only in the CCP manual for examples, but you can also have a look in the how-to guide. We gave 2 full examples for Dr. Herman Rorschach and Dr. Anna Freud, and you can have a look at their examples as well as how their practice manifested into goals. So we understand that you may not have the level of specificity that you want right now, but by the end of the year, your goals should be a little bit more crisp. Anything to add on that?
I see we're getting close to 5 o'clock, so I assume we're going to wrap up shortly. There are still some questions about the things like what kind of things count as different, as either engagement or so on. And I think the emphasis again is on flexibility. Am I not correct?
Well, that's correct, Troy. And I noticed one person said if they're on a board or a group or as a member of a consultation group sufficient. Well, if you're on a board, so for example, I'm on a board related to mental health, and I am the only psychologist on the board, and I am often referred to for advice and consultation on that. I can use that for professional engagement. However, if I'm in a consultation group, I could also use that and as engagement, and I can get credit for both activities. So that responds to one person's question. There was a question about if I'm retiring in 2023. Well, if you're retiring at the end of 2023, you still need to submit a description of your practice as well as your continuing competence plan for the upcoming practice year. Even if you're planning on retiring at the end of the year, throughout that year, you need to do continuing competence activities.
Terrific. Appreciate the answers to those questions. We tried to get a lot of individual answers. Dina, is there anything like last words?
Yeah, thank you for that, Dr. Janzen. There's a question Kathy Underhill wrote here, and I think it's a great question. How much time is this going to take me? Okay, that's a fantastic question. So if you look at the option paper planning, I've given some time frames. Depends. If you're going to sit down and you're going to do your thinking and entering at the same time, I can't imagine it taking you more than an hour. We're hoping that 30 minutes would be top. If you're going to break it out, you're going to do your thinking on the optional paper planning first and then just entering it. We're hoping that the time spent entering your actual activities will be 10 to 15 minutes. How much thinking time that you need about what your practice looks like, what your goals are, that's going to be dependent according to practitioner.
Yeah, I would say, Dina, when I did mine, it was about 25 to 35 minutes to do the paper form, which I filled out prior to doing the test situation online. So I would say leave yourself 45 minutes to an hour to do the paperwork, and then you may want to leave more time when you go back into the live system.
Yeah, I think that probably brings us to a conclusion. Any last words from either Dr. Martin or Dr. Spelicity to kind of wrap us up?
No, I'd just like to thank you for joining, and I would like to echo Dino's comments that much work has gone into the program manual, to the FAQs, to the technical manual, and I think if you have questions, that's the first place to start. And of course, because we have more than 4,000 members, what we are going to ask people when they contact the college seeking an answer or a question, we're going to start with, have you gone to the program manual? Have you looked at the website? Because we want those resources to be robust so that if they aren't answering your question, we want to go and update them and revise them so they are answering your question. So we really want, because for us, our staff, our small staff, to address 4,000 individual questions, we've invested that time in those resources. So we will hope you can rewatch the videos, you can go to the program manuals, and you can also check out with your colleagues who are going through the program as well, and see those resources and make sure that they are robust. If they're not, give us feedback on those resources. And there is information on who to contact in the resources if after you've reviewed those resources, your question hasn't been answered. But again, we really encourage you to look at those resources. We think they're robust. But again, if we're missing something, we'd like to know so that we can make it easier for everyone. Dina, do you have anything to add?
No, thank you. This has been fantastic. Great to have the colleagues on the line, and thank you for your thoughts. I think we're ready to roll.
Well, I'm looking forward to this year. In my view, having looked at the test run and everything like that, I think this is an elegant and simple system. I think most of you are going to find it rather easy to use and are going to find it not onerous. And so I really look forward to seeing what goals are for this year. And we think that this is going to be an outstanding addition to that's been long overdue. And so we're really glad that we're able to do this now. So thanks for everybody's time tonight, and we wish you well and safety. And we look forward to you at the next town hall whenever that's scheduled. So
all the best.
Okay. Thank you. Bye-bye.